Dr. Buzz,
Yep.
what is PRP?
Platelet-rich plasma, that's a good one. PRP is a treatment that we use in the facilities that can help the body heal quicker. Kind of the easiest way to explain it to patients is it's kind of like fertilizer that you can inject or use a needle to put into an area that helps areas heal better. Basically, what you do is there's a huge difference in PRPs. There's definitely it's used very loosely, but what most doctors are doing really isn't PRP, which is platelet-rich plasma. It's platelet poor plasma, and there's a big difference, and that's just the concentration of platelets because the platelets are the food or the growth factors that help things heal or make things more anabolic. But to get a concentration that really works, you need to take more blood.
Mhm.
And the vast majority of doctors, I talk to doctors all day long, every day. Most people who are doing PRP are simply taking a 10 ml tube of blood or 20 mLs of blood, spinning it one time, and calling it PRP. If you take the blood or that little bit of blood and only spin it one time, that's really platelet poor plasma by definition. Platelet rich plasma has to be at least 3x concentration. If you spin it one time, you can't get past 1.7 concentration. So that's the problem. And you'll talk to a lot of patients and say, "Have you tried PRP?" And they'll say, "Yeah, I went to another doctor, did it didn't work for me." First question I'll ask you is, how much blood did they draw? And if they say one or two tubes, I know that wasn't platelet rich plasma because you just can't get a concentration doing one or two tubes. So really, what the research shows is to get to, you really want to get to between like 9 and 12 billion platelets in an area to help it to heal. But to get there, you need 60 mLs of blood because there's only so many platelets per ml of blood. So, like with our kits, you draw 60 mLs of blood, you spin that down. Another thing that's very important is how you get the blood out of the person because platelets can get damaged if you pull out blood too quickly. So we actually have proprietary tubes that were actually originally designed for pediatric use, but they pull the blood out slower because you have to be very gentle in the way you pull the blood out of the body. Because if you pull it too quick, you can rupture the platelets, which you don't want to do.
Mhm.
So they pull the blood out very gradually, 60 mLs of blood. You spin that one time. You take the Buffy coat where all the platelets are at, and then you spin that a second time, and that takes you from that 1.3 to 1.7 concentration to the 9 to 12 concentration to get you to the 9 to 12 billion platelets. And once you have that, that's a very anabolic agent and very effective in healing like tendinopathies, helping cartilage grow back, healing muscle tears, used for aesthetic use. Um, but one other trick that people can use with PRP is what people also have to understand is if you're injecting a liquid into someone, whether it's PRP, A2M, Wharton's jelly, exosomes, if you inject a liquid into an area, it dissipates or clears from that area within a few hours or a day. So you get an effect from it, but the effect doesn't last that long. So the other thing I always recommend with anyone using PRP or A2M or any of these other biologics is also using scaffolding. And scaffolding is like a gel-like material that you can make with our PRP kit. You just take some of the platelet poor plasma that's left over, you heat it up, which changes the conformation of the protein and makes a gel. But that gel is very robust. And then you mix that gel with the platelet-rich plasma that you made, and you inject that gel infused with PRP, and that lasts in the area, whether you inject it for a joint or in a face or wherever, for a couple months.
Mm.
So it's more of a time release. So that prevents you from having to doing multiple injections. So, I know we covered a lot there. To keep things simple, PRP is fertilizer to take an area that's catabolic, that's not healing, and make it more anabolic. But not all our PRP is the same. It's very important how you draw it out. You have to draw it out slow, so make sure you're using low pressure tubes to draw it out. We also only use sodium heparin with ours because the anticoagulant also has a lot to do with the platelets and the viability of them. Sodium heparin is proven to be the best. That's what we use for our anticoagulant. And you got to draw enough blood. If you're not drawing at least 60 mLs of blood, you're not going to have platelet rich plasma. You're going to have platelet poor plasma.
Okay, and does insurance pay for the procedure?
Insurance, it's covered by some auto cases. Most major medical insurances at this point do not cover platelet rich plasma therapy. And I always explain to people all insurance works the same way. They look at platelet rich plasma as something that is a wellness or helps you heal, but it's not emergency medicine. And all insurance works the same way. If someone has car insurance, will they replace the tires on your car? Do they pay to have you wax your car? The answer is no,
Mhm.
because that's to upkeep it and maintain it. But if you get shot by a gun, then it's covered. That's an emergency. So
Right.
when you need a joint replacement, that's an emergency. You've waited too long. So typically, therapies like, whether it's Wharton's jelly, A2M, PRP, is not covered by insurance.